And welcome everyone to another edition of Inside Career Technical Education. I'm one of your hosts, Ann Baldwin. Joined in studio with me today is Jim Beloga, who is the president and CEO of YTI Career Institute. And Jim, we've talked on these podcasts before about what an emerging profession respiratory therapy is, and we're very excited to have Carl with us. And Carl is a program director for respiratory therapy at YTI. So thank you for being here with us, Carl. We appreciate it.
Thank you for having me.
So Jim, I'll let you, I know you know Carl, you know this program inside out. You've been behind the efforts to really expand it and to make it more widespread and available for folks that are interested in respiratory therapy. So I'll let you take it from here.
No, I appreciate that, Ann. And Carl, great to hear your voice. And just a little bit about the program and the history. I mean, we started this program, I want to say back in 2012, and Carl can correct me if I misspeak, but it's been a while. We went through the initial accreditation with COARC, who is the programmatic accreditor for the respiratory therapy program, and we had a successful 5-year run. And as we were going through evaluating all of our schools over the last few years, this was one of the schools that we looked at actually discontinuing. And it just happened that I was involved in another business sort of relationship, and one thing led to another, which led me to having conversations with the executive director of COARC. And we actually reversed our decision with regards to our Altoona campus, and in particular to respiratory therapy. And we basically restarted the program, and I'm excited that Carl, who had been with us through all of that, is still with us, and he's actually bringing some new life and vigor to the program, and it's exciting to have him here today.
Absolutely. So for folks that are listening and want to know more details, Carl, what exactly is respiratory therapy?
Well, that is the question that is most confusing of all. Really, no one outside of a respiratory therapist knows what respiratory therapy is. But we like to say we're a specialized medical field, and we are made up of certified medical professionals, the respiratory therapists. We sometimes are thought of as doctors by the patients, but we are not doctors. We work directly under the supervision of the doctors, and we treat problems of the lungs and problems of breathing. The nurses work directly under the supervision of the doctors also, and we are co-workers with the nurses, but we have different areas that we specialize in. We take care of lung cancer patients, asthma patients, people with emphysema, bronchitis, pneumonia. Currently with COVID-19, we are been thrust to the forefront, and a lot of people are asking about our career, whereas usually we're more in the shadows and no one knows what we're doing. But that's what we do. We're members of the code team. We go to all the traumas in the emergency room. We provide CPR, and we try to help the patients with their breathing problems as best as we can. And that's kind of like what we do. In the hospital is where we usually work most, and we take care of all of the equipment that is involved with breathing, oxygen flow meters, suction regulators, and nasal cannulas, those kind of equipment, BiPAP machines. It's very technical. In ICU, we manage and we take care of all the ventilators. So there is a big component of technology involved with our field, not just giving medicines, but a lot of maintenance and setting up and making sure that everything is working smoothly.
Right. So it's a combination of hands-on care, but yet science and technology and everything else that comes with that, because there's so many different machines and so many different regulators that you have to pay attention to. And you hit the nail on the head, Carl, when you said that, you know, prior to COVID, I don't think a lot of people were aware that there's actually a career in respiratory therapy. So how long does it take for a person to graduate in the respiratory therapy program? What kind of is the process? How does this work?
In our program, we're a 21-month program, which is a short program. We offer a associate's degree in specialized technology. So this, I think, is what we consider a fast-paced, fast-tracked course.
Yeah.
And you've also worked, Jim, you've also worked to expand this. So it's not just that you have to live in proximity of the Altoona campus now to sign up for the respiratory care program. So why don't you talk a little bit about the opportunity for people beyond those boundaries?
Yeah, no, exactly. And I was just going to sort of add to what Carl was saying, in that it's a 21-month program. And right now, we've just recently got that program approved for online delivery.
Great.
So the didactic piece, or the lecture piece and the project work, the online piece of that comprises about 75% of the program hours. And then the remaining 25% is related to clinical care and direct clinical experience. So, so what we're doing with this program is it's currently out of our Altoona campus. So we now are able to provide this program throughout all of Pennsylvania. However, we do have interest in in states that are nearby, and so and Carl can probably elaborate a little bit more on this, but we have interest from New York State, from Maryland, from the Virginias, if you will. I believe there's some interest out of Ohio, some interest out of New Jersey. So I think the fact that we're making this program flexible for somebody to take it online, and they don't have to come to Altoona per se. My hope is that this program will expand as more people learn about it and learn. And obviously with COVID, we know COVID's going to probably be around for a little bit of time here, and so. Our hope and my hope is that as folks become more aware of becoming a respiratory therapist, that they'll have interest in our program.
Right. And we should also mention, though, you take this online wherever you are, and then all you have to do is find a place to do your clinicals in your area.
Correct.
Your future, maybe even your future place of employment. So, Carl, let me ask you this. What kind of jobs are out there for students once they graduate from the respiratory care program? What are they looking at?
What kind of jobs do they end up doing?
Sure.
Is that what you mean?
Yeah, you talked about some of the roles that they play in the hospitals and things like that. But where are some of your students? Where have they landed?
Well, the majority of people end up working in the hospital. That's where the majority of the jobs are in medical care. And they have gone across across the whole nation. I have people working in California. I have one of our graduates who went into the military, and he is doing helicopter transports, still in the United States, but I guess he can go overseas. I have people in North Carolina, New Jersey, California, and Maryland, West Virginia. And that's students who are just from this area. I mean, they lived in Altoona. They did not take the online course because it wasn't offered then. They lived here in Altoona, and then they just spread out across the nation. Most people in the past that lived here in Altoona stayed here in the local area, stayed in Altoona. But they don't have to. Our certificate, national certification, is good throughout the United States, and is also recognized by some foreign countries. Saudi Arabia is a big employer of American respiratory therapists. So they can go wherever they want to and that kind of thing. And they end up in the hospital. They also are employed in long-term care facilities, a step up from nursing homes where they would have ventilators and semi-acute care. I have one of our graduates who works directly in a doctor's office and sees all of the doctor's patients who are having breathing problems, asthma and stuff like that. Home health care is another place. Everyone sometimes suffers with breathing, sleep apnea as they get older, and they have to be fitted with these machines that they wear in their bed now. And the home health care technician takes care of that.
Right. So, it just goes to show you that, as Carl mentioned, this is a emerging field. and you're throwing the net out even further that you could practice here in the United States as well as other countries. So, how can people get more information, Jim, on the respiratory care program?
Yeah, I think if anybody has any interest, just yti.edu, and we've got a program page right there. And again, if students have interest, they can. We have webinars that we're doing every week where we showcase all of our programs, including respiratory therapy. We have a webinar Wednesdays, and for YTI, it's at 3 p.m. on Wednesdays, and you go to website, sign up. You can actually go to our website, and if you're already interested and ready to go, you can apply now and go through the whole process online. So that's the best place. yti.edu is where all the information resides.
And Jim, when is the next start?
We'll be starting the next program on Monday, October 19th, 2020.
So, Carl, are there any requirements for folks who want to get into the respiratory therapy program?
Yes, there are some requirements to get in. As I said, it is a associate's degree in specialized technology, so you do need your high school graduation diploma or the equivalent, a GED, to get in. We require a driver's license, clear background check, a clear child abuse check. We also require your vaccinations, which essentially are your childhood or public school vaccinations. You need to have your first vaccination of the hepatitis B completed, and there are 3 of that. Most current people coming out of the current public school system already have these done, so it's nothing really dramatic. Unless you're a foreign student, some foreign students don't have any of their vaccination records, so then they have to get their vaccinations. And we do require, of course, a clear drug test, and that is work-related because all the hospitals require the exact same thing.
Right.
And there is a entrance test, the TEAS test, that they have to have a passing grade on that, the test of essential academic skills for allied health. And that just has a background in math and science and conversational English, if you will.
Well, it doesn't.
That's about it.
Well, it sounds like pretty reasonable expectations. So, again, respiratory therapy is really an emerging essential field. So many folks out there right now are wondering how to recreate themselves, if you will, or what to do upon graduating high school. This is a career that definitely is thriving and growing as we speak. So we urge you folks, if you're interested in more information, to go to yti.edu. So we really appreciate your insight into this this emerging career, Carl. It sounds like the possibilities are endless, and we hope that we've kind of tweaked people's interest and that they will go to yti.edu. Jim, congratulations and hats off to you for not only maintaining this program, but seeing that it can be really taught remotely, as this is the world that we're kind of in right now.
Yeah, no, it actually worked out great. I mean, I'm not sure we could have planned it any better. And Carl's been instrumental in helping us revamp the program, and he's been doing this for a fairly long time. So he is very, very experienced and seasoned. And I want to just say thank you to him and the team that we have of respiratory therapists that are helping educate future respiratory therapists.
Absolutely. Well, I found this conversation very interesting, and hopefully you did as well. We want to thank you for tuning in to this edition of Inside Career Technical Education.